biggest disappointment that we've seen in the last 3 months has been the interference and intervention of governments to help ensure that there isn't efficient response to this most global of crises. Now, that's not such a problem if you look at central banks, because even if they're not assertively coordinated, they all are rowing in the same direction. They have the same playbook, they kind of understand what they need to do. But when you talk about things like medical supply chain and treatments, and most importantly, vaccine. For example, President Trump has said that the United States is leaving the World Health Organization, literally in the middle of a pandemic. It would be hard to come up with a more inane policy suggestion than that. Now, to be fair, Trump doesn't actually have the authority to leave the World Health Organization. It takes a year to do. So it wasn't a very meaningful thing to say, but it reflects the fact that the United States is uninterested in cooperating in terms of sharing of data, in terms of collectively responding to put together a vaccine. Now, there are over 110 vaccines in various stages of development right now. And there are some that are trying to work together to ensure that when vaccines are created, that they will be available globally. Bill Gates, the World Health Organization, Antonio Gutierrez, and the EU, again, I mean, has been one of the positive stories here. The United States, absolutely not. China, absolutely not. And so, you know, if you wanted to look at why is it that I'm more pessimistic about the response to this most global of crises, it's in part because you don't have a lot of government effort to ensure that the most substantial human capital effort of our lifetimes, I mean, the fastest we've ever before gotten a vaccine for a new disease was mumps, 4 years. We desperately need this in well shorter than that. And, you know, most of the epidemiologists working on it believe that we'll get some vaccines that will be available for some frontline workers in healthcare in the middle of next year. But what you need is a global effort to find a global vaccine for a global disease. And we're not going to get that. Instead, what we're going to have, I'm fairly certain, is a pretty fragmented response with the people that are most capable of paying for it, having access to those, the majority of those vaccines for the first 6 to 12 months. And given that that vaccine, assuming it works, is what allows you to start having a new normal in your economy and getting, you know, demand and supply and sectors that are otherwise sucking wind back up to speed, and thinking about bringing globalization, whatever the next phase of globalization looks like, to actually be there, there's going to be a massive geopolitical fight brewing over that vaccine. Interestingly, right now, it looks like the 3 vaccines that are in development that are closest, one is the Chinese-Canadian team, and the other 2 are private sector efforts, one in the United States and one in the United Kingdom. We'll see if that's what it ends up looking. And people like Bill Gates are saying that they're likely to either all work or all not work because they're using the same basic technologies. And we'll find out, you know, in the next 3 to 6 months, a little bit more than we know right now. But, you know, this is geopolitically, this is going to be a lot worse because of that lack of alignment. And first of all, one thing that's rewarding to see is that there are some poor countries out there that have done a fantastic job responding. So it's not as if it's just about Merkel and, you know, Ardern in New Zealand. Vietnam, for example, with great contact tracing and quarantines early. They had a lot of experience with MERS, with SARS. They put that into place. And as a consequence, they were able to bend the curve down, and their economic outlook this year is a hell of a lot stronger than it would have been otherwise. Argentina, which came into this in the worst possible environment, and yet you have President Fernandez bringing together the entire government in a non-cheerleading kind of way saying, here's what we need to do, leading with science, putting the scientists out in front, putting the health ministers out in front. And as a consequence, his approval ratings have gone up, and Argentina's handled this better than they might have otherwise. Greece, I mean, you know, this is a country that has had some of the, I mean, they've gone through a Great Depression themselves over the last decade. And yet again, very effective early stage response in lockdown and in getting the entire government rowing in the same direction. It's places where you're not politicizing. And here in the United States, we're even politicizing the wearing of masks. It's the only advanced industrial economy in the world where a question of mask wearing is being made into a patriotic one. It's insanity, right? And that's not happening in other advanced industrial democracies. But when you look at the rest of the developing world, there have also been some really big problems with really bad governance, like Brazil and Bolsonaro in particular, and Pakistan and Imran Khan in particular. And in those countries where you already don't have the money to afford long-term lockdowns, where people are living closer to subsistence already, and where you couldn't do social distancing if you wanted to, because so many people live in slums and favelas where, you know, there's gonna be all sorts of transmission. The healthcare system isn't close to adequate, and they don't have anywhere near the testing that we have in the United States or in Europe or in South Korea. All of that implies that the outbreaks that you will see as the epicenter of the virus shifts into the developing world, in those places where governance is bad, is going to be a lot worse than what we've experienced in the United States and Europe. And that's going to be compounded by the fact that we're not going to have good data around it. In the United States and Europe, at the very least, you've got a lot of localities. You can actually get good, transparent data around, do you have surge capacity for ICU beds? You're not going to have that locally in Brazil or in Pakistan. And so not only will they have the economic impact of the known virus, but they'll also have the economic and political impact from people saying, we don't trust any of this, and we're not prepared to reopen. We're not prepared to engage. It's a very serious problem that I think you're going to see playing out through 2021 at the minimum.